And good morning. I'm Dr. Deuk Majan. We are broadcasting live from Deuk Spine Institute. Today we're going to be doing a couple of surgeries. The first one here is a patient with bad neck pain. He's had facet joint treatments in the past at C7-T4. They worked for him. However, his pain came back. So it's exactly the same pain. It's facet joint pain. However, he doesn't want to keep having facet injections and what's called RFA, because the RFA procedure, the problem with it is that it actually stops working after a while, and the reason for that is the nerves grow back. Okay, so he wanted a more permanent procedure, and that's why we recommended the Deuk plasma rhizotomy for him, which is really a procedure where we go in and destroy the pain nerves called the medial branch of the dorsal ramus. We destroy those pain nerves permanently. Okay? And yes, that's possible today to do that. We do it at Deuk Spine Institute. And we do it quite often, as a matter of fact. Feel free to type questions up if you have them. I'll be happy to answer them for you. Shot? But you can see the probe is being placed right on the spine where the nerves come in from the side of the spine, and they actually come in and innervate the joints in the spine called the facet joints. The problem is facet joints do get arthritis from injuries, and when you get arthritis in a facet joint, there's really no good way to get rid of that arthritis. However, we can get rid of the pain from the arthritis. So you may not be able to get rid of arthritis, but we can get rid of arthritis pain. And that's what a rhizotomy procedure is all about. Shot? Getting rid of arthritis pain. Once again, we can't get rid of arthritis, but we can get rid of arthritis pain. And I'm literally, with my probe, I'm dancing along the lateral margin of the facet. And we call it the Deuk spine slide, right? And what we're doing is we're sliding my probe, my electrocautery probe, along where the pain nerves live, killing them. And the nice thing about this procedure is that we've never had anybody come back and have to have it redone. That's how effective it really is. Now, people will come back because they have pain in other areas, but they don't have to come back for this particular procedure at the same levels where they had it done before. The thing about spine pain is that it comes from trauma to the spine, usually. And what causes trauma? Well, sports accidents, slip and fall. Shot? There's a variety of causes of trauma. Shot? I'm going for T1 right now. I need to be a little bit higher. Shot? Still too low. Shot. Shot. That's a little better right there. Wouldn't you agree, Jordan?
Yes.
Shot. Shot. I'm trying to get my probe in the right spot. Shot. I think that's it right there. That's really good. You want to be on the bone. What you're aiming for is the junction of the superior facet, shot, and the transverse process. Can you show our audience that junction, Jordan? It's pretty much right where my tip is. And I'm moving it around in that area to make sure that I burn that pain nerve. Shot? Right there. Wouldn't you agree, Jordan? Shot. Wait. Shot. All right. I think we've done as much there as we can. That's T1. We're going to work our way down. Shot. Want to head down to T2. Shot. 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 What do you think about that, Jordan? Looks good, huh? Yeah. Shot. Two lateral. Shot. 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 That looks really good right there. I can feel the facet. Shot. Oh, by the way, for those of you watching, you can see his plate from his prior surgery. Pressure. You could see the metal plate. Jordan, show them the metal plate. We did not put that plate in. This is a fusion done by another surgeon, and the problem with fusion is you get adjacent segment disease. Show the arthritis at C7-T1 on my side. Yeah, right there. You had it. That area right there is a arthritic joint. The arthritic C7-T1 joint. That's where a lot of the patient's pain comes from, is those arthritic joints. Shot. Now we're going to head down lower. He has pain in T1 to T4. We know that because he's actually had treatment before. Shot. Shot. Yeah, you can move your hand. Shot. Too low. Shot. So we're using a needle at this point called a spinal needle to guide my approach to the place where we need to basically find and destroy the medial branch of the dorsal ramus, which is the pain nerve that is responsible for transmitting pain signals to the brain. Shot? Yeah, that looks good. Maybe a little bit higher than that, right? Shot, let's see if that goes a little higher. Yeah. That's looking pretty good right there, huh, Jordan? Yeah. Yep. We're going down to T3 and T4. Sorry, T2, T3, T4. We've done 7 and 1 already. Shot. That's too low. Shot. We'll get down there later. Any questions? Shot from the audience.
No current questions, but we do have a comment or seeking advice from Rafa on YouTube.
Sure.
They said, "Good morning. I have arthritis in my back but my doctor wants to do a discogram to pinpoint my pain.
Uh-huh.
That's all they said.
I see. Well, a discogram is a test to see if pain is coming from a disc shot. And it's not a bad test to do. We do them here as well. So I think it's reasonable to do a discogram, but I honestly don't think you need it done. If you were our patient, we would be able to tell you where your pain comes from just by looking at your MRI and doing a physical exam through a Zoom meeting. So if you want to have that done, we're happy to do it for you. I think discograms are, I hate to say this, but mostly unnecessary nowadays because with our advanced understanding of pain and where it comes from, we now can determine the source of pain without doing a discogram. All right, that burn went nicely. Moving on to the next one. Shot. Uh-huh. Can see the transverse process. Yep. And now I'm I don't only, by the way, for those of you watching, we don't only rely on the x-ray, we also feel. As a surgeon, you have to feel with your tool, with your fingers, to make sure that you're in the right spot. Because the truth is, if you're not in the right spot, shot, that you're not going to get a good result. So for MBB, you want to feel that you're basically on the bone. And I can feel the bone here. I can feel it, literally feel it. Shot. Shot. And you have to be able to feel it. Shot. And you got to move it, or you move your probe around, by the way. You can't just take one picture and expect to hit it every single time. You have to be prepared to move and find the right spot. And it just takes sometimes taking a few shots with your machine to identify the exact source of the nerve. I think that's pretty good. All right, yeah, I think we got it. I can feel, I'm actually feeling the TP as I'm doing this. I'm literally sliding along. So that's 1, 2, 3. We got one more to go. Shot?
We have another person seeking for advice.
Uh-huh, sure.
This comes from Claire on Facebook.
Hi, Claire, on Facebook.
They said, hi, from Ireland. I had a fusion from L45
Shot.
to L5S1 and still in agony.
Oh,
I'm
sorry to hear that.
I'm now being told I have lordosis and need surgery to fix that, which will be
Shot.
3 surgeries.
No, that is not correct. You do not have lordosis that needs surgery. That's ridiculous. Those surgeons don't know what the hell they're doing for you, Claire. The reason you're having pain is your disc is hurting, or your facets, and we can fix that for you at Deuk Spine. Don't have more fusion surgery. It's totally unnecessary. These doctors are fusion happy, and they're making a lot of money just doing fusions on patients like you. I strongly recommend you come to Deuk Spine Institute in Florida and get a real fix that doesn't involve fusion. It turns out that all the pain that people have in their back and neck comes from either the facets or the disc is number one, a disc herniation. Okay, number one, disc herniation, number one. That's about 80% of the causes of back pain. Okay? Then after disc herniation is facets. That's around 12%. Okay, 12%. And then shot. Shot. Is you doing all right?
Yeah. I just put the pop on.
Yeah, we're done on this side. So disc 80%, facet 10%. Both of those problems can easily be fixed without surgery, without major surgery, just endoscopic or what we're doing right now, percutaneous, okay? Which is the plasma, rhizotomy. So you don't need a fusion. Lordosis is not your problem. That's not why you're having pain. There's no such thing. Lordosis causing pain I've never seen that in my entire career, 26 years as a spine surgeon, fixing people's back pain all the time. Never have I seen lordosis as the cause of their pain. You may have lordosis on your imaging, but it is not the cause of your pain.
Aren't we all supposed to have a natural?
Yeah, we all have lordosis, by the way. But she's talking about like hyperlordosis. A lot of these surgeons tell their patients that lordosis is the reason, they need fusion. They need deformity correction surgery, but it's not true. Shot? They do not need that. Yeah, that's good. We can fix it with a tiny little incision and a 1 hour procedure. That's outpatient. And you can go back home to Ireland in the day after your surgery with us. Okay? So I would not get it done. Send your MRI to Deuk Spine. Henry, give her the DeukSpine.com MRI form that she could fill out.
Copy that.
That link. We're seeing a lot of unnecessary surgery happening, folks, especially fusions. So many happening, and it's just totally unnecessary. There's no need to put any metal in your body permanently, folks. The only reason to do fusion surgery today, in my opinion, is if you have cancer eating your spine away, and then you need stability from that because the bone is gone, or if you have bad infection like tuberculosis, which is common in some third world countries. Okay, I see it a lot on the internet. We don't see it a lot here, but we see it a lot on the internet. A lot of people writing in with their spines being eaten away by an infection called tuberculosis. Very common in like India and Pakistan and countries like that, where tuberculosis is so common, unfortunately. And then of course, so infection of the spine where it's destroyed the spine, that's when you need fusion, which 99% of people out there, they don't have that. And then tumors. And then the last thing is fracture dislocations, like trauma from a motor vehicle accident, okay, or a bad slip and fall, where your spine is literally fractured in half, which is, again, these are rare situations. Shot. So by far the most common reasons for people to have back pain is their arthritis of their spine. Basically, disease of the disc and facets. The disc and facets, those are joints, okay? This is not an infection or a fracture or tumor. It's literally disease of the facet joints and the disc. And that can be fixed with Deuk laser disc repair and Deuk plasma rhizotomy. There's no reason to have fusion done at all. Shot? So don't get any more fusions, folks. Stay away from it. The world is changing. Technology is changing, and I'm telling you right now, those fusions that all these doctors are doing are completely unnecessary, and they don't need to be done anymore. They just don't. I used to be a fusion surgeon. I know everything there is to know about fusion, everything. If you don't believe me, go watch my YouTube videos. You'll see that I've done hundreds, I've done 1,000 lumbar fusions. I've even published papers in the medical journals, peer-reviewed and published on lumbar fusions, okay, and cervical. I was one of the top fusion surgeons in the United States in terms of quality of fusions, and maybe not quantity, but certainly in terms of doing a lot of them. This was years ago before I started doing the endoscopic surgeries. Now with endoscopic and plasma, laser and plasma, there's no reason to do fusions anymore. Not in an outpatient setting where people have back pain and neck pain. Can all be treated with these minimally invasive procedures. Hold pressure here. Hand off. Shot. All right. Let's go to our next target. The nice thing about the facets is that you can find them using an X-ray, usually. Shot. And you can see right where the pedicle is. Shot. Like right where that circle is. Show them the pedicle I'm aiming for here. Shot. And the medial branch of the dorsal ramus is just to the side of it, right where I am. Yeah, there's the transverse process. Show them the spot right where I'm at, basically, just a little bit north of where I'm at. Here, I got it. Let me just, hold on. Let me just put my grabber on there so I can hold it without getting radiated. Shot. That's the spot right there. It's a perfect spot. Where the tip of that needle is, folks, that's the exact target you want to aim for. Knife. So we did a little numbing medicine to numb things up for him, make it more comfortable. And we'll be done in less than 5 minutes here. So what we've done is treat his facet joints, F-A-C-E-T. And I told you that's the second most common cause of pain in the spine is facet, F-A-C-E-T, facet joints. The first being the disc. Disc pain is the most common, and that's why doctors do discograms like the other viewer was asking about, Shot, because they want to know, is the disc causing the pain? And a lot of times if it is, they'll tell you to do an artificial disc or do a fusion. Well, now we have the laser surgery as a better option than artificial disc or fusion. No, 2 more levels after this. Shot. Yeah. Remember, when you do these procedures, you must feel the bone, okay? You cannot rely just on the X-ray. So I would not deliver the dose of energy unless you feel the bone. I feel the bone, I'm dancing on it. That's why we call it the Deuk spine slide. I'm not just dancing on it, I'm scraping it. I can actually feel the transverse process, okay? You see where the tip is? It's right on the transverse process. And I want to be just a little bit more medial. And I can literally feel the bone that I'm sliding on with my probe. Okay? Why is that important? It's important because the nerve that we're trying to deaden lives right on the surface of the bone. So if you're not on the bone, you're not getting that nerve. So remember, I used to do spine surgeries in this area with fusions, with open surgery for years, many, many years. 26 years, as a matter of fact. And I've been in all these places. So I know the anatomy quite well. All right. We need to go down one more. I know the anatomy quite well, and I've used this device that I'm using now for many years to basically burn tissues off the spine. And it looks good. And basically, that's what this device is used for. It's called an electrocautery device. And it's used by surgeons to do surgery, including spine surgery. So its application here is new when it comes to percutaneous and for the treatment of these peripheral nerve that are painful, but by no means is it never been used in the body before. Shot. Now, why don't other doctors do this kind of stuff? Well, they're not trained to, number one. And number two, you have to want to cure the patient, and a lot of doctors don't want to cure the patients. They just want to treat them temporarily. 1, 2, 3, 4. Got one more to go. I'm going to try to go in through the same incision. Our patient is sleeping comfortably. He's not intubated. He's what we call twilight, okay, which is how we do these procedures. Twilight. Shot. Shot. So you don't have to have general anesthesia for this procedure. Shot. That looks pretty good, right, Jordan? I'm right on the bone, so I'm doing the Deuk shuffle, the Deuk slide.
We have a couple more questions.
Sure.
This next one comes from Timeless90 on YouTube.
Timeless 90.
They said, I believe either my facet joints or disc leakage is the cause of my pain. The pain is localized around T1 to T3. The spine looks healthy on the MRI.
Well, Timeless, I can tell you right now, your spine has a problem, and we could find it at Deuk Spine. So just to cover this topic for everybody, and I'm going to take this question, then I'll head over to you, okay? And we'll just run a testimonial.
Copy.
But here's the problem. 99% of doctors miss the diagnosis, okay? It doesn't matter if they have a good MRI done. They're going to miss the diagnosis as to what causes your pain. 99%. 99%. So what does Deuk Spine do different? The first thing we do different is we make the right diagnosis. And of course, the patient has to have their pain when we're making the right diagnosis. So when you come into our, do an exam with our doctor, the first thing we're going to want to know is where is the pain coming from? Is it the disc? Is it the facet? Is it both? Is it the SI joint, for example, the piriformis muscle? So there's literally 30 causes of back pain, and there's 21 causes of neck pain, basically. And we need to figure out of those causes that are potential causes, which ones does that patient have? So I guarantee you, you have at least a disc or facet causing your pain. The problem is the doctors don't know how to solve that problem, okay? And because they don't know how to solve that problem, you're going to go without a diagnosis, like so many millions of people go without a right diagnosis. And so it starts with making the right diagnosis. So what we offer at Deuk Spine is what's called the free MRI review. For any person around the world, we'll literally, if you upload your MRI to our server, okay, and there's 3 ways to do it. You can mail your MRI in by FedEx or UPS. You can upload the images in a portal that we have on our website. If you fill out the form, you'll see it. And then finally, the last option is to give us a portal from your MRI center with a login credential. So those are the 3 options. Once we have your images, I will look at them. Our doctors look at them. And we do a Zoom meeting with you. And in that Zoom meeting, we're going to be able to ask you questions, look at you, examine you, as well as look at your MRI at the same time. So the 3 key elements to making the right diagnosis: history, what you tell us; physical, what we see on that Zoom call, and then the MRI. So if you have those three things, we will make a diagnosis 99% of the time as to what's causing your pain specifically, and we'll be able to fix it after that. There's no cause of pain we can't fix at Deuk Spine, okay? All right, we're going to take some more questions, but in the meantime, Henry, if you could just type up that address, mri.deukspine.com.
Already did. We're all good.
And then I'll come answer some more questions face to face.
Copy that.
All right? Thanks, everyone. Yeah, let's run a testimonial. If we've got a plasma rhizotomy one, that would be great. If we don't, just do the DLDR one. Hello, I'm Dr. Deuk Majan at the Deuk Spine Institute, and I'm here with one of my patients who's just came in for a checkup today, and she had the Deuk plasma rhizotomy. This is a new type of rhizotomy being done to treat facet joint pain. I say it a lot, but the most common cause of back pain and neck pain is a herniated disc. The second most common cause is a arthritic facet joint that's painful. And the standard treatment these days is something called a radiofrequency ablation, or RFA rhizotomy. The problem is that RFA rhizotomies don't deliver very much energy. Hello, I'm Dr. Deuk Majan at the Deuk Spine Institute, and I'm here with one of my patients who's just came in for a checkup today, and she had the Deuk plasma rhizotomy. This is a new type of rhizotomy being done to treat facet joint pain. I say it a lot, but the most common cause of back pain and neck pain is a herniated disc. The second most common cause is a arthritic facet joint that's painful. And the standard treatment these days is something called a radiofrequency ablation, or RFA rhizotomy. The problem is that RFA rhizotomies don't deliver very much energy to the facet joint. So if they get the nerve, usually it's temporary and the nerve just grows back. We figured out a way to deliver more energy through what's called a plasma rhizotomy. It's a Deuk plasma rhizotomy, and you had it done about a week ago. How do you feel today?
Amazing.
Yeah?
I have zero pain. So
And what did you say to me earlier? This is the first time you've been pain-free in
years.
years. How many years have you been dealing with back pain?
Yeah, probably 10.
10 years.
It's been a long time.
And
yes.
you look very happy.
I'm very happy.
Now,
very happy.
you did have the RFA. It worked for, gave you some relief for a little while, then the pain came back. And this feels different though.
This feels different, as in within 2 days I had zero pain.
It's awesome.
And now here I am a week later. I can run a marathon, I think.
Good.
I
Well,
mean,
we want
I
you
won't
to.
yet, but I can, so.
All right, and there's millions of people out there, and that's why we do these testimonials, really for them, not for me, not for you, but it's to spread the message of hope that there is a way to get out of back pain. You just have to stick with it, find the right place, get the right procedure, and eventually you can get there. And what do you say to that?
I say you're correct. That's Deuk Spine Institute didn't give up on me. I've had several procedures, but you kept pursuing my pain until you figured it out. So thank you very much.
You're welcome. My pleasure. Anything else you want to say to your fans out there?
To my fans, come see this man. He is amazing. Deuk Spine Institute staff is amazing. Everyone treats you with respect, and they listen to you. That's very important to me. So I just want to encourage people, don't live with the pain. Please come see Dr. Deuk and Dr. Patel at the Deuk Spine Institute.
I appreciate you saying that. The lesson here is don't give up on your pain.
Yes.
There is a way to fix it. And a lot of patients, probably about 25%, end up having more than one source of back pain. And we have to treat each source because each source requires a slightly different treatment. The rhizotomies definitely were what you needed, but you needed a rhizotomy that worked well because of all the inflammation of the facet joints and the scar tissue. And the plasma rhizotomy is the most powerful rhizotomy that can be done. It's only done at Deuk Spine Institute. So congratulations on your
Thank
new
you.
lease on
Thank
your
you.
back. All right, let's get you out of here. Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are, pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk Machen, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All
life.
right, thank you.
Okay, Dr. Deuk Machen here. We just got out of the operating room, and we did a procedure to treat facet joint pain, and we've had a couple of comments and questions, and I just want to make it very clear to people. This is important. So what causes neck pain and back pain is there's a specific source of that pain, okay? And the vast majority, like 98% of the time, it's coming from what we call degenerative conditions. And what are degenerative conditions of the spine? They're basically injuries that over time the joint wears down and becomes arthritic. And they're injuries to joints. That's the first thing. So degenerative conditions are injuries to the disc joint or the facet joint. You guys see that there? So in the front of the spine, you've got a disc joint. It's a big joint between the vertebral bodies. Why? Because 80% of your weight of your body goes through the vertebral bodies. These are bones in the front of your spine. So you got to have a joint between them that will actually last for a long time, right? And it's got to be a big joint. That's your disc. And then 20% of your body's weight goes through the back of your spine through your facet joints. And there's a left and a right facet joint for every disc. So basically 100% of your body's weight transmitted from you, like your weight of your head, your arms, your shoulders, your chest, all your organs inside, they all go straight down through the spine. All of them attached to the spine, and then the weight goes down to the spine. So you have all these weight columns going through your front, middle, and then your back columns, all right? So over time, as we go through life, we get injuries to our spines. You're injuring your joints. You're injuring your disc and your facets. All right, so when it comes to treating disc problems, we do the Deuk laser disc repair. It fixes all the disc problems. It's the best treatment in the world. It's done endoscopically. When it comes to fixing facet joints, that's different, okay? So facet joints are these little joints in the back of the spine, and for this particular patient, we did his cervical and thoracic. So you see this, that's the C7-T4 facet joint right there. That's your first thoracic vertebrae. It's got a big transverse process. And the pain nerve target is right there, where the transverse process meets the facet, right there, okay? And you can see what an RFA does. Radiofrequency ablation does that small little burn right there. It doesn't work and it doesn't last. The Deuk plasma rhizotomy, on the other hand, we pioneered at Deuk Spine. With our Deuk Spine probe, you basically create a much bigger burn area, which kills the nerve permanently, and it doesn't come back. So that's what we targeted: C7, T1, T2, T3, and then T4. Everything went well for the patient. I expect him to do well. Give me a second. I'll have to call them back. All right. Am I back?
Yeah. Okay.
So we'll take questions about the Deuk plasma rhizotomy procedure we just completed.
First question comes from Zachary on YouTube.
Hi, Zach on YouTube. Welcome to our live stream.
It asks, my neurosurgeon wants to do an endoscopic discectomy for a C6, C7 herniation, pinching the nerve at the left foramen. Is this a suitable option?
So your neurosurgeon wants to do an endoscopic discectomy at C6-7. So first of all, his endoscopic procedure is not a true endoscopic procedure. What he's going to try to do for you is he's going to go through the back of your spine, and what he's going to do is he's going to do a tube. It's called a tubular retractor. It's not true endoscopic surgery. And he's going to literally drill a hole in your spine with removing this bone right there at C6-7?
Yeah.
And by doing that, now here's the problem. The nerve is coming out this hole right here called the neuroforamen, right there. And it's actually getting pinched by a herniated disc in the front of your spine. The best way to treat it is to go through the front with the Deuk laser disc repair and to zap away the herniation, get the pressure off the nerve, which is getting pinched in the front. By going in the back, he's doing sort of an indirect procedure that doesn't work. In my opinion, you may get some temporary relief of your arm symptoms, but it'll come back. And the reason it'll come back is because now he's taken away the bone, the facet joint, which is the joint that stabilizes your spine at C6-7. You've got a left and a right facet. He's going to have to drill that facet joint out or remove it. He's either going to use a drill or he's going to use biters called Kerrison rongeurs. But there's no way to get to decompress the nerve through the back of your spine at C6-7 without removing important muscles, ligaments, and bones. You do not want that done. It's going to weaken your spine. You might feel good for a year at most, and then you're going to be back again having a fusion done. These types of treatments that are leapfrog treatments, one, then the other, you should be avoiding them. You want a single procedure that's going to fix it. My advice is look into the Deuk laser disc repair. It's done through the front. We do a 4mm incision, go through the disc to the back, and I use a laser to take the pressure off the nerve root. That's what I would recommend. If you want to know if you're a candidate, send your MRI to us at mri.deukspine.com. I'll look at your MRI, review it with you on a Zoom call, and we'll figure out what the best treatment is. But I'm telling you right now, what he's doing, your surgeon, endoscopic, it's called a foraminotomy. It's done through the back. He's going to be drilling holes in your spine. That never lasts. People always have problems. Do not get it done.
Next question comes from, well, I believe this is seeking advice, and it comes from Rafa, once more on YouTube, saying, I have X-ray, CT scan, and MRI. I'd like to have a second opinion about this. I'm not convinced about having a discogram I'm not convinced having a discogram having retrolesthesis, bulging disc, and degeneration disc. Already had a L4 to L5 fusion 30 years ago.
Rafa, I'll be happy to do a second opinion for you for free at Deuk Spine Institute with me. You just go to mri.deukspine.com, and there's a form. You just put your name, where your pain is. They're going to ask you a few questions, and then you're going to send us your MRI. Either send us the CD or send us give us a link to your portal with login credentials, okay? Or upload and sweep your images into our portal. So you got three options, everybody. You can either pop your CD in your computer, which a lot of computers don't have CD readers anymore. So you either buy a peripheral, connect it through a USB port, pop your CD in, you can open it up, you can drag and drop your pictures right into our website portal, or you can mail us your CD of your MRI, or you can get a portal link from the MRI center along with your credentials to log in and send it to Sam. Okay? But it all starts with filling out the form. I'd be happy to give you a second opinion. I believe your pain is coming from either adjacent segment disease, which is a disc above or below, either 3-4 or 5-1, but we can fix it very easily. You do not need the discogram done. I will tell you where your pain's coming from without a discogram. We used to use discograms years ago, lots of them, and were very helpful at proving the pain's coming from a disc. But at this point, we're so far advanced, we don't need discograms anymore. We can figure it all out ahead of time without a discogram, just by where you show me the pain is, as well as the MRI, and getting a little bit of history from you.
Next question comes from Carlos on Facebook.
Hi, Carlos on Facebook. Welcome.
He said, I am being considered to get an epidural shot for my L5 to S1 herniation of 5 to 6 millimeters. L3 through 4, 3 to 4 millimeters. Oh, I think that means epidural shot for both.
Mm-hmm.
Would you recommend me trying that?
Yeah, Carlos, great question. So you've got 2 small herniations, it sounds like, based on the MRI findings of what you described, and they're probably causing back and leg symptoms like leg pain. The only reason we do epidurals now is if the patient cannot have the definitive surgery to fix it. Epidural will not fix your pain, ever. You may feel better. You'll feel better for a little while, okay? Maybe 6 months, maybe 3 months, maybe a week, maybe a year. If you're really lucky, a year. But here's the thing. The moment you start doing activities, the moment you start playing sports, the moment you start exercising, going to the gym, whatever it is, you're going to be loading that disc, you're going to be pushing out more herniations. And as you do that, you're going to get more symptoms. So my advice is get it fixed properly. And the proper fix is the Deuk laser disc repair. I go into the disc through the tear, I use a laser to clean it, remove the herniation. It's the herniation stuck inside the wall of the tear, that's what prevents the tear from healing. So if I can eliminate that herniation with the laser, which I do, then your disc will actually heal naturally. And you don't need metal, you don't need fusion, you don't need laminectomy, discectomy, anything. You're done. Your disc will heal and it's perfect. So should you do an epidural? Only if you want some temporary relief. Understand though that steroids given an epidural injection will raise your blood pressure, so you have increased blood pressure, which can cause headaches, malaise, even stroke in a worst case situation. You'll get steroids, which also raise your blood sugars. The blood sugars go up. You can get diabetes temporarily, usually not permanently, but that higher sugar can cause problems. Steroids also cause muscle weakness. They cause personality changes, bad dreams, nightmares, agitation. So there's a lot of personality stuff that come with those steroids. I personally don't recommend them. We don't recommend them anymore at Deuk Spine, but we can do it temporarily. If a patient's in a lot of pain, they got to wait 2 weeks for their surgery, we'll do an epidural for them, make them feel better.
All right. The next question comes from Margaret on Facebook.
Hi, Margaret on Facebook. Welcome to our live stream.
They said, I've had 17 back surgeries and I'm still having a lot of pain going down my right leg.
I'm
I
so
have
sorry.
had head extensive hardware in my back. Oh, goodness.
Margaret, my God, I mean, you are exactly why we do these broadcasts. We want people to not go down that road. I'm so sorry. 17 back surgeries. It's a shame that doctors are doing that to patients. You know, we've been presenting our data and our results now for years at meetings for neurosurgeons, pain management docs. It's published. They all know better, yet they still do it to people like you. And the reason they're doing it is they're sucking you dry of money. They basically like ticks. They just get on you and start drinking your blood. Instead of blood, they're drinking your money. We don't want to suck you dry. We just want to fix you, and then we want to be done with you, to be honest. So what we offer at Deuk Spine are permanent fixes for pain. Now, we don't get 100% of the pain every time the first visit. However, if you develop other pain elsewhere, we'll bring you back and we'll fix that as well. You've had 17 surgeries. I'm very sorry to hear that. We can probably still fix you. I just need to see your MRI, maybe a CAT scan as well, and use our link that you can see that Henry's put, mri.deukspine.com. And go on there and I'll be happy to do an MRI review for you.
Next one comes from Neil on Facebook.
Hi Neil on Facebook, welcome.
And they said, neck manipulation, is there any type of injection medication diluted with the trigger point injection to reverse the circulation? I noticed sensor cane in YouTube videos reverses the circulation about 60%. What also can be added to sensor cane reverse to circulation and release the entire spine from cervical, neck to tailbone?
Yeah, great question. So you're talking about medications like sensor cane, or what else could be used. Medications never fix back pain and neck pain, okay? The first thing you have to understand, people, is that there's a cause for back and neck pain. And every single one of those causes, every single one of them, is a surgical fix, okay? I used to believe, oh, surgery is the last resort. I used to tell people that because that's what I was trained to do, like a little monkey, okay? And that's what everybody's been trained to do. Surgery is the last resort. Here's the truth. You do surgery when surgery is necessary to fix the problem, when only surgery can fix the problem. It turns out that facet joint pain, the second most common cause, requires plasma rhizotomy to cure, or fusion, but you don't want to do fusion. The biggest cause of back and neck pain is the disc, all right? The disc injury, like a herniated disc, bulging disc, slip disc, ruptured disc, protruded disc, extruded disc, whatever, prolapse disc, you pick the name, it's all the same thing. It's a tear in the back of the disc, in the wall, that lets a little bit of the jelly out, or a lot of it, and that's where the pain comes from, that tear. We discovered that at Deuk Spine Institute 16 years ago, and we published it. So that tear needs to be debrided. Now, that happens when you do a fusion, and it happens sometimes when you do an artificial disc. However, it happens 100% of the time when you do the Deuk laser disc repair. We go in there and we find the tear and we clean it out with a laser. And what we're cleaning out is granulation tissue, scar tissue, calcium, and herniation. So the only way to get rid of pain is to identify the source. The number one cause is disc, number two is facet. Rare causes in the neck include tumors, fractures, infection. I rarely see those problems. So really the number one and number two cause, 99% of neck pain, disc, facet. Medicine is not going to fix those problems, ever. You might feel better for a little while, but the pain will come right back. That's the problem. If you don't address the source, the pain keeps coming back. There is no medication, there is no therapy, there's no massage, there's no chiropractor, there's nothing that works except the rhizotomy for the facet pain and the Deuk laser disc repair for disc problems. I'm dead serious, folks. Everyone's gonna figure this out 20, 30 years from now. The question you have to ask yourself is, do you continue to wait for the rest of medicine and healthcare to catch up with our understanding of what causes pain, or do you go to the source, the people who discovered the source? That's us at Deuk Spine.
And lastly, we have, I believe they're seeking advice. This is from Claire, a girl from Ireland.
Hello, Claire from Ireland.
And following up from her message from above, that she wants us to know that she's had an SI joint fusion also, and revision surgery of both. I'm in absolute agony. I'm a 43-year-old nurse / midwife and haven't worked since the age of 30. Been sent from one doc to another. The pain is worse. Is that worse than my lower buttock and proximal high thigh?
Claire, I can guarantee you we will figure out what's causing your pain and we can fix it, all right? There's only one kind of pain that we cannot fix here at Deuk Spine, and that is piriformis, but we do treat it, we give injections. The only thing we don't do is cut the muscle. Now, it requires an orthopedic surgeon to do that if you have a piriformis syndrome. Someday we will have an orthopedic, but in 2023 we don't. We're a small company. What we do have is the ability to make the right diagnosis and cure your pain. Now, if I can't do your piriformis release, we'll send you to someone who can. But the key is we need to know where your pain's coming from. To do that, we must do an examination. MRIs do not tell you where pain comes from. X-rays do not tell you where pain comes from. CAT scans do not tell you where pain comes from. EMG nerve conduction studies do not tell you where pain comes from. No test on earth except for a discogram or facet block, will tell you where pain comes from. The patient tells you where pain comes from. And discograms use the patient's response. That's why it's the patient. Facet blocks use the patient's response. That's why it's the patient. Only the patient can tell us. It requires a knowledgeable, experienced doctor to interpret where the pain is coming from. And that is what's lacking around the world. Doctors don't figure out where the pain comes from before they treat you. They just treat you. Okay? And they're treating people based on MRI and X-ray findings. MRI and X-ray findings do not tell you where pain comes from. That's why the results are so bad, because they're not relying on knowledge and experience about where pain comes from. Deuk Spine Institute is different. We're the only ones in the world that actually figure out where your pain comes from and treat the source. You will have to come here for that treatment. So start packing your bags, buy a ticket, and get yourself here to Florida and visit Deuk Spine. All right, we'll be back. We have a 1-level lumbar Deuk laser disc repair next, L45. Patient has back and right leg pain from a herniated disc at L45. I believe he's had a microdiscectomy in the past, so he's got a scar on his back. I did not do that surgery. I do not do microdiscectomies anymore. They're bad surgery. So he's got a microdiscectomy, and we're going to go and fix a herniated disc that he's had a reherniation from his microdiscectomy. So join us in about 30 minutes.